Otro ámbito, que es el patrón de consumo entre turistas de la droga, la experiencia de Holanda, de Amsterdam, está aquí Cedric, el coordinador, que se están planteando en Amsterdam, ¿no?, con los coffee shop, bueno, los centros de consumo. Cedric nos va a hablar de la situación, la experiencia holandesa, el turismo de la droga.
Does it work? Yes. Good afternoon, my name is Cedric Charvet. I'm very glad that there are still people in the room. It's been a very long 2 days of expert panel, and I'm no expert. I've been working and coordinating a users room, but I'm originating from a social pedagogy field, and I will make an old-style presentation so you don't have to look at the screen. I would like to present the situation of Amsterdam regarding what we call the mobile drug users. And half of the presentation will be about who are they, who are what we define as mobile drug users, why, and the second part of it will be the latest trend in Amsterdam, what we see in terms of nationalities. First of all, when we talk about mobile drug users, we define them as people who are staying in region where they are not administratively registered. That can be tourists, refugees, asylum seekers, immigrant commuters, and so on. There is many people who fit into this category. That's why if you say drug tourist, mobile drug users, it will fit in the category of people that we give access to users room in Amsterdam. The understanding of it, it's been studied for many years. The movement of drug users is mostly related to three main, how can I say that, cause. And those causes are principally the social and political climate in any given country, the availability of drug services, and the quality and availability of drug. You understand that when I talk about the social and political climate in a given country, I'm going to give you the sentence that I hear the most in the users room that I coordinate. I will prefer to be a free drug user here than to be an inmate in my own country. Lots of the clients we are facing, if they will not flee persecution, they will be in prison for using drugs, consuming drugs, buying drugs, selling drugs, and so on. Looking for a better place without the persecution, you are seeking for places like Amsterdam, maybe Bilbao, maybe Barcelona. Having said that, I think you all understand that the more a country has a kind of liberal and pragmatic approach, the more this country or those countries will attract mobile drug users. The second point I talked about is the access of drug-related services. The majority of mobile drug users coming to Amsterdam are not especially only seeking drugs, they are also seeking programs which did not exist, or do not yet exist in the country of origin. For the people who were here this morning and who followed the presentation of the EMCDDA from Portugal, you understand that countries who have very low possibility of access to methadone treatment, like Slovakia, Poland, Lithuania, and so on, are largely represented in our users room. Even more so, Russia. In Russia, methadone is illegal. So we see also a lot of people who come to Amsterdam thinking, oh, West Europe, I can get methadone, so I go there. In 2010, half of our new registered clients are from the ex-Russian bloc, Lithuania in particular. Another thing very simple that I said before, the easy access to drugs. Where there is drugs, drug users are going. So I'm not so surprised when I see a map of the users' room. They are mostly in harbors or in peripheral cities or at border cities. And that's, let's say, for many years in places where drugs comes. I believe Vancouver has been explained this morning. That's a big harbor. Amsterdam has been also for many years a part of the drug smuggling route. So clients who want to have good drugs, they go where the good drugs is. Clear till now? Okay. I'm going to try to make a very brief and parallel history for you to understand why I make a presentation about mobile drug users and we are in a conference about drug consumption room. If you think about what the Swiss experience is, about the Latin and what we call open drug scene, and Amsterdam had the same problem in the late 80s, we had major amount of drug tourists using in what we call open drug scene. To eradicate the problem, most of the politics took what we call pragmatic approach. Let's try to find a solution to increase the health of those users who are in what we call open drug scene. Therefore, instead of kicking out the drug tourists out of the country, the idea was to open drug consumption room and make it even more possible in other countries. The first example was, the first consumption room is originated from Switzerland, but very soon after, Holland and Germany followed the example, and the clients originated from Holland or Germany in Switzerland, they disappeared. They went back home because there was possibility also in those countries, Germany, Netherlands, to access drug consumption room and other services.